Hey, good morning, everyone, and welcome to Euronurse. I'm your host, Vic Sinise. Welcome to the show. We come to you every Saturday at 9 a.m. Central Time. I know we're a little bit behind because our guest speaker actually is having a big ice storm where he's at. So hopefully no issues during the show, but we're all connected up, so it should be good. Hey, if you're watching us live, great. Glad to have you on board the show. You could be watching us on any of those channels. We are glad to see you joining us. If this is your first time joining us, welcome to the show. Be sure to check out our website at euronurse.com, the best place to learn more about the show. Also, check out our other podcasts. There's links to all those too. And our past shows are all available, all 127 of those episodes, at any time you want to watch them on demand. Go right ahead and watch those. Maybe you want to just listen to us in your car. No problemo. Just go to our Euronurse Plus area where all of our audio podcasts are available. Every episode has its own audio podcast, so you can listen to us in your car from any of your favorite podcasting platforms, such as Apple Podcasts, Amazon Music, Spotify, and YouTube. This week, we're joined by Ralph Lombardo from the company that makes Elitone, and we're going to be ditching the pads, stopping the leaks, and feeling the freedom in just 6 weeks. Ralph's going to be talking to us about all that. And let's go ahead and bring Ralph into the show. Ralph, welcome to the show. How are you doing today?
Thank you so much. Doing well, other than the weather outside. And just let everybody know, connectivity has been a little weird here. But for the last 20 minutes, it's been pretty good. So hopefully we can get through this.
All right. Why don't you tell the audience a little bit about yourself and the company and what you're doing?
Sure. So I'm a dietitian, but I've been in the medical arena with medical device and medical drug arena for over 40 years now. And I'm the chief business officer of the company, Elitone, the manufacturer of the Elitone devices. And we met Vic, and we've just developed such a nice relationship. We really believe in his work. And so we have a device that is now actively, right now as we speak, more than 30,000 women across the country are getting benefit, maybe close to 35,000 now, and are actively using the device. And so we're really growing rapidly. And our presence with clinicians, urologists, urogynecologists, the nurse practitioners, physical therapy is really growing with our product because of a few things that we'll get into, but it's really growing, and we're real happy with what we're seeing.
Great. Well, let's go ahead and bring in your slides, and I'll let you take it away.
Sure.
There you go.
So, I'm speaking to the experts today, of course. So when you see this title, Live Leak Free, you're probably, thinking, oh my gosh, it's so tough, especially for the more advanced the patients that are, have been suffering with this, for a long time. And, you're probably thinking, how do I completely leak free? And so I want to just make sure that we're all, aligned on this. The product, does provide substantive improvement with the patient, with their quality of life, and is a real evidence-based option. I think we all know, I'm not going to spend a lot of time on this slide, but we all know the burden of incontinence. We have a new device. It's a male device. It's being studied by the NIH. It's very close for us to submit to the FDA for approval. We spend a lot of time with physical therapy, and their feedback for us is that, the patients that are really motivated to get this fixed they stay compliant. They really want to see improvement. There are some challenges that we see in urology, urogynecology, geriatric medicine. And we just have a nice, simple solution that's evidence-based that works. And we're going to try to explain why it works so well today. But you all know, you're the experts. the negative impact that incontinence can have on someone's quality of life. Some of this one thing here that just jumps out at me is that if for the patient that is moderate to severe, and just looking at what's published, 70% of these women don't want to travel more than 30 minutes from home. And so that's a sentence, right? That's handcuffs the patient. Thank God for you and what you do to help these patients. One of the things that enables our patient to be compliant is the product simplicity. We have high acceptance, very high acceptance. If there's anything for you to remember today, we have very high acceptance rates, more than 90%, by the way, in the very senior patient. And what's more importantly, when we dive in a little deeper, the senior patient across ethnicities. And one of the reasons is that the product is external. It's not an internal biofeedback product that, some of the products are so large and, like it's just, for some patients, it's just not acceptable. And so on the science side of this, I'm going to ask you to just think, what the impact would be if there was direct neuro stim. That's very important. Neuro stim. That's how Medicare defined our device and its approval for reimbursement and coverage. So we have great coverage with Medicare Advantage plans. And these patients do very well. But think about the impact of direct, not indirect, neuro stim and modulation for these patients. And we'll talk about why this is direct. The burden of proof for us to get approval was that this had to be equally as effective or more than vaginal products and percutaneous products. And we were. And we'll get into the science behind that. But just on a quick, glance, you can see this is worn externally. And as a result, we get acceptability with patients that perhaps otherwise that don't want an implant, that, do not want a vaginal device. I'll speak to this. It's going to come up now, but it's later, but it's appropriate for us to speak to this now. Of the 35,000 patients, you can add another 3.6% onto that number currently that have returned a device. We only have a 3.6% return rate. And that is exceptional in this category. The return rates for other products like this is over 20%. And so it kind of speaks to the acceptability, the ease, how simple it is. I had a mentor in medicine who said to me one time when I was doing diabetic counseling, and she said to me, look, we can't interface with the patient in a complex manner. It has to be simple, effective, and then she used this word, true. And if you can be simple, effective, and true, you will get compliance. And so that's what we're talking about today. But when you prescribe this product, the patient gets a kit that takes them through an interventional treatment period. And by the second week of treating, and we'll get into the treatment protocol here quick, by the second week, we see a greater than 50% reduction in stress events and with our overactive bladder device in urge events. So neuromuscular stim, our product has been shown to stim, like for the overactive bladder patient, if there's any urge component, they get a stim and a modulation of the pudendal nerve And they also get an interface with the detrusor muscle if it's urge, and then if it's stress, then the pelvic musculature. Okay, and we have two devices. One is called Elitone, and that's for stress and mixed incontinence. And I'll get into that when you're seeing the little arrow here. And then we have Elitone Urge, which is specifically for urge incontinent patient without any stress component. The way this works, you'll see right under targeted neuromuscular, right under the AR and neuromuscular, a 2000 hertz carrying wave. Medicine is only as good as its delivery system, right? Many topical products do not work effectively or have lower bioavailability because the transdermal delivery mechanism isn't efficient. But what we see is that this 2000 hertz wave that is kind of like the bridge. It bridges across the dermis, and then the contractive 50 hertz wave and the relaxant 10 hertz wave then have direct access right to the patient's area and need. And this is why we see such high efficacy and bioavailability of the treatment patterns, of the neuroactive patterns and muscular patterns. And we saw the same efficacy in women, even with BMI in the high 40s, in the 40s, as women that had very low BMI. And it all has to do with this carrying mechanism. This is all patented, right? The way that this works. And so we have great efficacy. It's real important as you as scientists, right? And physiologic experts understand the delivery mechanism. It's very important. And that's why we see high efficacy rates. So for the patient that presents with stress only, no mixed component, Elitone works. For the patient that presents with stress with a mixed urge component, Elitone, the device, the blue, works because they get a contractive treatment followed by a relaxant treatment. So we can relax that pudendal nerve and the detrusor muscle. And we see great efficacy in both demographics. For the urge-only patient, the overactive bladder patient, Elitone Urge works great. You can see they get 6 seconds of a calming or muscle relaxant treatment, followed by 6 seconds of rest, followed by 6 seconds of calm, rest. These devices deliver 100 of these patterns in a 20-minute session. The devices are preset for 20 minutes. We can't see this because I'm not operating directly with the PowerPoint, but on the right-hand side, this is a ultrasound image of the lift of the contractive wave. And if I was doing this directly from the PowerPoint, you would actually see the ultrasound movement. And so I have physical therapists and providers ask me all the time, is there any evidence that this is actually working? And so we do. Now, the relaxant component, it's very hard to pick that up with ultrasound. It's just difficult, to get it. But we see great efficacy, and we see a quick response in both demographics. And so that's probably the best evidence that you prescribe it, and then you check in with your patient in 2 to 4 weeks, and she says, yes, I'm leaking a lot less. And by the way, if you think about it, in our clinical studies for the stress device for Elitone, the average amount of time these women were incontinent was right at 11 years. And so they didn't have any pelvic tone at all. And to think that in 2 weeks, we can restore some pelvic strength and health, it's pretty significant, right? In terms of what we can reverse pretty quickly. And it all has to do with that direct bioavailable treatment. This is great. We have urologists across the country, urology offices, and primarily nurse practitioners that are using this device. The way Medicare defined our product, they defined it as neuromodulative stim. And so we had a urology academic center in North Carolina call me one day and said, look, we want you to know what we're doing with your device, because we were getting a ton of prescriptions from them. And she said, for the patients that are refusing percutaneous, treatment, the patients that we just can't get to come in, 12 times, we're offering your product. And we've noticed the way it's defined that we can actually bill for using it in session. So we're scheduling a 99214, which is about $177. This says 99215. It's really a 99212, 91214, 30, 40-minute encounter. We're putting it on the patient. And by the way, they would ask us to drop ship the device directly to them in their office. So they would have the patient come back in and have this encounter. We put it on them. We turn it on. We're treating that patient with the device. The devices come charged. And we're billing the neuro rehab code. We're billing the 99214. And for new patients, we actually get a little more money. The e-stim that this provides, and then the education. And it all adds up to a little more than $400 of reimbursement. And it's only one encounter. And so this has been a nice mix. And, we're happy with that, because no one can educate the patient better than you. I mean, you're the expert here. And man, this device in your hands for that demographic has been good. We have a lot of urologists that are prescribing this. When they prescribe physical therapy, pelvic floor physical therapy, they're prescribing this right with it. They send the patient to PT. Oh, I'm freezing up. Vic, am I still okay? Or my it looks like our.
No, you're okay.
Okay, yeah. Okay, I just want to make sure, because we're going in and out. We were going in and out here. And so, when they're prescribing PT, this is a perfect adjunct. The patient can't go every day to PT. And so while they're in between sessions, they can continue their treatment at home. And we get the synergistic results with PT and this device are substantial. Really, really good. And that's why we're getting a lot of buy-in with physical therapy right now. So you guys know this. There's a substantial clinical need. I had one of the large urology clinics. I don't want to say it's a big lug pump member here in Georgia. I don't want to say who it is. That wouldn't be appropriate for me to do that. But, it told me a story. And she said, let me tell you what we're seeing. We have a lot of senior women. They're on weight loss medicine. And not all of the insurance companies pay for it. That's a high out of pocket for them. We've prescribed the beta-3 agonist. This is for the overactive bladder patient. They're leaking, and then they get into a financial conundrum. And what we see is they give up on the beta-3, wear pads so they can keep on their weight loss medicine and other medicines that they're on. And your product with the copay, our copays are like $10 a month, for this device. It's a rental. Now, some of the Medicare Advantage plans, provide this as a purchase item, like through DME, so that rental doesn't mean anything. They keep it, they set up a monthly payment plan, and it goes. And then we have a lot of patients, still the majority of patients pay cash for this, because we have a payment plan, for cash. But when you write a prescription, they're mostly covered. Medicaid in 26 states will pay for this. And Vic, we can send out, 22 states. We can send out that, that list so that your audience can tell if this is a Medicare or, patient. Medicare does pay for it in the Medicare Advantage plans, except for Blue Cross Blue Shield. Okay. So, there's a lot of cost coming at these patients today. And so a low cost, evidence-based, FDA approved option they can use in the privacy of their home, where they don't have to lie on their back or sit, is really being accepted well throughout the country. I'm going to stop here. I thought this would be good for you guys to know who created this. Our founders, these are bioengineers. They were J&J engineers. These two have about 50 patents, active patents, not pending, but patents on medical devices between them. Gloria, our CEO, she presented here a year ago, and she asked me to provide a little different twist, to the devices. At the time, we didn't have the overactive bladder product approved, but she delivered a 9-pound baby girl, and then about 3 years later, 13 pounds of twins, and developed incontinence. And she said, I just want to develop something that has high acceptance, high bioavailability, and something that providers can introduce to patients as another tool in their arsenal for some of these patients that are falling through the net. And we've received just an excellent feedback and response. And we see this once doctors and nurse practitioners start prescribing, they keep prescribing. As long as we're good in getting the prescriptions filled. Every once in a while, we have eligibility issues. And in fairness, some of the insurance companies have high deductibles for this demographic, or if the senior selects a lower premium, plan, they can have high deductibles and everything. And we do everything we can to try to help them. But sometimes, just in honesty and fairness, it doesn't work out. So I want to be 100% fairness. But we have a high success rate with the prescriptions. About 80% get covered and paid and delivered. Okay, I think this is important for you guys. You guys are the first, right, gate in regulatory oversight. These are FDA cleared class 2 devices. A class 1 is like a back brace, something. I'll give you a little reference, copper fit back brace is not even cleared by the FDA. The more back braces that are, let's call it, used and prescribed and have reimbursement are class 1s. This is a class 2 because there's a patient controlling aspect. A class 3 is an implantable, like a intrathecal pump or, something like that. This has its CE mark. So the equivalent, the FDA and the European Union has approved our devices. Well, we make these in ISO certified manufacturing centers. Those are the highest quality centers that the FDA gives out ISO certification. So you should know that the quality standards these are manufactured in have met the highest thresholds for FDA certification. And of course, Medicare and Medicare Advantage approved. I mentioned this number is significant. We're very proud of this. That's our return rate. And I want to tell you, the majority of this is because the patient, after they have the device, found out they had a contraindication. The contraindications are a device for the heart that stimulates the heart. Right now, my mind is slipping me. Vic, maybe you can help. A pacemaker. I'm sorry. Yeah. We used to have active cancer treatment contraindication, but no more. That was lifted. And sometimes if they have an implant, but you know what? I'm going to tell you this honestly, 99.999999 out of 100 nurse practitioners said, that doesn't matter. We're fine with this. And we don't have that issue. For the senior patient, cognitive impairment, where you don't think they can use the device, is a contraindication. We've won so many awards, and we're winning more awards every day, and it's because of just overall women's health and focus. Vic, I'm going to quit sharing. Can you quit sharing? I want to talk about the male device just a second. Sure. I don't have any visual representation of the male device. The gel pads are smaller. If you have further questions about the gel pads and how the product works and everything, you can send them to me by email and we'll send you material. Anytime we have a prescribing center clinic that starts to prescribe, you get your own custom packet of information. We send those out when you write your first prescription, and then we work with you to educate you and the staff. We have clinical liaisons that are advanced degree that work to help, educate. I do a lot of education. I've been doing this for a long time. And so, we're able to help you. But this is such an easy product. If you open the box and you see the little visual in there, you're like, I got it. I think we're good to go. You manage much more complexity. I want to talk to you about the male device, just real quick, because that's going to be, we expect approval and launch of that in May, June of this year. The results we're getting from the NIH study and the Yale study have been exceptional. We're seeing exceptional improvement in incontinence post-prostatectomy. There's a lot of evidence when used prior to the surgery, it's even better. It's a smaller design, right? It goes behind, of course, the scrotum, between that and the anus, and it works extremely well. We have a lot of men right now that are using the female device. We just, when we get a prescription, you guys can use off-label. So, you can prescribe off-label, which you do with a lot of medications, et cetera. But we just snip it and we show them how to use it. Now, we're not able to sell the product or promote the product or educate the product. But with medical inquiry, we have safe harbor, and we're able to say to a nurse practitioner or physician or physical therapist, yeah, this is what you would do. But the male device we see as being a real arsenal, right, for at-home use. I was on a call yesterday with one of the chair folks at Yale, the urology department at Yale. And he said, you know what? He said, it's so amazing. Sometimes the female patient, if they're leaking and they're down from 8 pads down to 4, they're happy. But the man, if he's got one episode, he's like, I'm still leaking. I can't take this. And you guys are probably all familiar with that demographic. So we see a real opportunity with the male device because they can use it at home, right? It's there and they can continue to use it. And this is real important, and I'll stop here. The maintenance regimen with this, because you have muscle and you have nerve hyperactivity and you have to keep treating it, right? Not every day like a beta-3 or an anticholinergic, right? But 50% of the patients needed to use the device 1 20-minute session per month to maintain their health. 30% never needed to use the device again. And 20% had to use the device twice a month to maintain health. And so that's a very fair, right, offering for the patient, an expectation for the patient. And typically, honestly, what happens, they start to leak a little bit again, then they use it again, right? And they get themselves back in order. But with that, Vic, I'm going to stop. And if we have Q&A, I think we're kind of on schedule here.
Yeah, we're great talk. I'm going to open up the questions to the audience. If you have any questions for Ralph, go ahead and put them into the comment box. I'll be glad to bring those up. I'm going to kick it off myself. Can you go into the actual treatment protocol that we should expect patients to follow? So we kind of talked about 6 weeks. I mean,
yes.
If I'm a typical patient coming in, how often am I going to use this per day, and how long?
So Miss Patricia, nurse practitioner, prescribes the product. The patient gets the device. They need to wear it 4 to 5 times a week for 6 weeks. That's the interventional treatment period. Some women think if they use it more often, it's better, but you can overtrain tissue and nerves. And so more than 5 times a week, we start to see the opposite effect, and only once a day. So that's
for how long?
For 6 weeks.
How long is it? No, how long is each treatment?
The devices are preset, Vic, for 20-minute session, and then they turn off.
Okay.
These have to be charged. One charge will last 3 treatments, and then they have to be recharged. They're charged with the little USBs. Very simple.
Now, you had mentioned on a couple of things that it's a rental program. The patients rent this.
So that's just the DME. The patient gets the device, and then it's like a prescription. They have it at home, and they can use it for 13 months, and then they keep it. So it's called rent to own. And so the way the billing,
they're not returning these.
No, they're not returning it. The way the billing cycle works, right? Through durable medical equipment, is that it's on a rental. But they call it a rental, but it's It's really not. They just have a transaction once a month. It's like a copay once a month for, I think it's like $10 to $15 a month for 13 months.
And you did mention that there's a return policy. So if somebody got it, was dissatisfied with it, the return is at 100%, or how's that work?
Yeah. So it's a 60-day money back guarantee, and it's fully warranted too.
Wow.
For as long as they have the device and own the device. The only thing that typically wears out on these is like a cable or a cord, and so we just replace it. We just send it back out to the patient. The transistors, they rarely fail, but the 60-day money back guarantee, the patient can get a full 6-week treatment. If they're not happy, they can return it. Everything is, money back, all money back. But our return rate's only 3.6%. So yeah,
that's impressive. Yeah.
Yeah. Very, very impressive.
Especially when you compare that to, like you said, the medications. We know what the dropout rate is huge.
Yeah.
So I do have a question that came in here from Nisha. I'm a nurse practitioner in California. Where do I send the prescription?
So if you, Nisha, I'm going to take a picture of your name here. If you, Vic, if you can send her my contact info. We have a prescription document. It's called a detailed written order. You use that to prescribe. You fax it right into the fax number. You can e-fax it or hard fax it. Most of the practices we're using, they just put that document, or they just e-fax a prescription over to our fax number. We get it. We do the eligibility. There's no prior auth on your end or the practice's end. We manage all of that. And every patient is contacted within about 48 hours of us receiving the prescription. We have learned the faster we contact the patient, the faster they want to move forward. And so it's very important that we have high touch, very rapid touch with the patient. So I'll send that, Vic.
I did post
yes,
your
there it is. Yeah.
Email into the comments.
Ralph at Elida, ELIDAH.com. And then you just send them right into me. We have a national team that works on these eligibility, and when we have an eligibility situation, you as the prescriber get a message back. Patient had high eligibility, high deductible, did not want to move forward, so that what's happening here. You just need to let us know that should we drop ship the device to the patient, or do we drop ship the device to you? So we would need your address on the prescription. Most prescribing clinics now are asking us, no, you send it to me because I want that patient to come back in here, right, to see me, to give them the device, to train them on it. But if you don't want that, we can send it, right back to the patient. Then the DME company educates the patient on how to use it.
Ralph, Orlandis Thompson is asking if you have a fax number.
Yes, let me pull this up. Can I just take 1 second?
You can post it into the comments. Yeah.
Post it in the comments. Okay, 1 second.
While you're doing that, I'd just like to say thanks to everybody who's watching live. I got Raj, Nisha, Queen, Diane, Leo, Katie. Nisha, you're in California. Hopefully you're away from the fires. I think all of our prayers go out to everybody in California. That's just unbelievable. I have a friend of mine who had their house burned down to the ground. And I mean, it was just to see it personally, what it's like to have to go through that experience, losing all the pictures that they had taken and things like that you don't appreciate until it's happened. So definitely prayers go out to them.
Vic, the fax number is, it might be quicker if I read it off to you and you put it in. So 833 830 1310. Vic, should I upload this detailed written order so they can see it?
You can send that to me, and we lost you somehow, Ralph. Your picture went out.
Oh, I'm sorry. Yeah, I might. Can you hear me okay or no?
We can hear you just fine. Yeah.
Okay. Yeah. I'm sorry for the connectivity issues. It's just, I guess. When God sends
Nope.
ice, you can't stop
No
it.
problem. I'll watch for if your picture comes back on. In the meantime,
Okay, sure.
I'll put me on so we just have somebody on the screen.
Yeah.
All right. So we do have that fax number here for you guys. You can go ahead and jot that down. It's in the comments, so you'll be able to write it down or copy and paste it, whatever. Nisha says, I'm in Northern California. Yeah. So glad to hear
Amen.
where
That's
you're
right.
safe. Praying
Yeah.
for everyone in Southern California.
Amen.
Yeah.
I have a very dear friend who lost his home there. Sad.
So Katie Bortel said, is compliance better with female or males?
So far in the clinical studies, this is hard to believe. We've had 100% compliance with the male subjects. That's hard to believe.
Yeah.
With the females, it's still high. It's over 90%. And Vic, your audience would better know this than we would, because we're just, based on what we see in patient reviews, et cetera. We think it's because of the low, it's not invasive, the low invasive nature of the wear, right? This is a wearable technology and it's acceptable. You know what I mean? That's what we think, but these are your team's the expert here. They may have different thoughts on that. You know what I mean? That's what we think.
I'm not surprised on the male because you mentioned something earlier, and it's really true. I think all of us that work with patients with incontinence, females will tolerate incontinence much better. Like, oh, I'm only wearing a few pads, but one drop of urine in a guy's pants and he's on, going nuts.
That's
what
Dr. Renzulli told us yesterday. He said it's just incredible how compliant the men are with PT, with everything that we do.
Yeah. One of the questions I had is because we do sometimes have patients that'll watch this show to learn more. So from the experience on a patient side, what do they usually say as far as what's it feel like to do the therapy for 20 minutes? Is it uncomfortable? Is it painful?
Yeah.
Can you give us a little bit?
Yeah, that's a really good question. This device, the way it's designed and the way the transdermal carrying mechanisms work, the patient doesn't, it's not a TENS unit. So it doesn't work like a TENS where you can get shocked. Does that make sense, Vic?
Yeah.
So there's no urgent, we're shooting the patient up through the ceiling. That doesn't happen. And there is an intensity setting that the woman can use, right? Very low intensity up higher. And regardless of where they put the intensity, they're still getting treated and it's still as effective. So that's kind of a personalized, individualized preference setting for them.
All right, good. So should not have to worry about it being uncomfortable, well tolerated.
Yeah, very well tolerated. We don't get any, I mean, as an ISO certified FDA approved manufacturer, we have to report adverse events and, et cetera.
So I did have a question here by Maria. Will this presentation be available for review after today? I'm interested in sharing with colleagues. Absolutely, Maria. All of our episodes are available on our website, uronurse.com. Shortly after the show ends, I actually update the website, so it'll be available. So you can watch it. You can also go to our YouTube channel, our Facebook page, our X page. All of those also have it available on demand. So, yep, it's going to be out there for you.
Vic, one thing that I do a lot of, I get a lot of requests from all different specialties to do virtual, lunch and little in-servicing, where during their break, they just have me on a computer like this, and we go through something like this. And we have one that's designed for 15 minutes. It's so quick. It's so simple. And I do a ton of those. And so if anybody would like me to, they can just email me. We set it up and we use the 15-minute version. So it's quick and, we don't interfere with, interoffice process and stuff like that.
Good. Yeah, you have that email up there.
Okay.
Yeah, absolutely. I think this is great. I don't see any other questions coming through. So I'm going to go ahead and switch over here to my plug for next week's program.
In Your Own Nurse episode 129, Ureteral Stents, survey says. Vic Sinise dives into the complexities of ureteral stent management and explores findings from a recent survey conducted by Your Own Nurse. This episode sheds light on best practices, patient experiences, and innovative approaches to improve outcomes for those requiring stent placement. By examining key data points and real-world insights, Vic discusses how healthcare professionals can balance the benefits of stents with their potential discomfort, enhancing patient care. Tune in next week to uncover evidence-based recommendations and actionable strategies for optimizing ureteral stent protocols.
Yeah, this has been kind of fun. I've been using my UroNurse platform to create some surveys and survey you guys, the listeners. And it's been great to get some information, and it's going to lead to some future episodes that are discussing it. Next week, I did this one on ureteral stents, mostly because patients are complaining a lot about how much, on my patient side, my uro patient, they'll complain about how much they hurt, having a stent. Actually, so much so that I've actually created an episode that's going to be following this one at 10:30 on why ureteral stents hurt. So I thought, this was kind of, after seeing a lot of comments coming through from patients complaining, and, there are some things that can be done to make it better. So anyway, we're going to have an episode on that. And that's why it triggered me to think about doing some research and getting some information. So join us next week on UroNurse to learn more about that. Stick around at 10:30 if you want to check our Uro patient out. Go ahead and do that too. Also, just to plug our newest podcast that just started last week with Dr. Jeff Albaugh. It is going to be having a second episode this coming Tuesday, January 14th at 7 p.m. Central Time. And that's going to be Empowering Women's Sexual Wellness, a conversation with Dr. Susan Kellogg-Spate. So join us for your sex and intimacy programming every Tuesday at 7 p.m. Central Time with Dr. Jeff Albaugh. So with that, I'd like to thank everybody for showing up today. I had a great episode. I'm glad, Ralph, everything worked out finally in the end with your internet issues and all your weather, because sometimes you just can't help that.
Yeah.
We're lucky enough to get everything to go here. And do get one final comment came in here. Great information. Thank you for this talk, and have a great weekend. Absolutely. I live in Indiana, and we got about 3 inches of snow yesterday. So, and I live on a lake. The lake is frozen. I've got snow, and I've got some cross-country skis I'm going to put on and go out and enjoy some of this nice weather. Nice weather for me. All right, Ralph, take it easy, and we'll see everybody next week.